secondary stuff that she'll have to ask about below the ROS, which will be low back pain and cough congestion. Right? So that should mean then for systems to get knocked out should be an NT exam, lymphatic exam, lungs, cardiac, neuro, and back. Right? We all tracking? Okay. All right. So first, give her my vital signs. Give her some info here.
Yep. And they had a professional photographer, that's who these are from. But yeah, we did a shared out. So, yeah. And where's that at? In Massachusetts. I think so. Yeah.
Alright. So that's what she gets. Everyone able to read my chicken scratch? Past surgical history, too numerous to list. Ramipril, levothyroxine, duloxetine, multiple supplements. Okay. Past medical history, hypotension, hypothyroid, PTSD. Okay. So that's what we got.
And you're making her a male, correct?
This is me.
You're the patient. I thought she, okay, I'm feeling it, I'm feeling, okay.
No, I'm the patient.
Yeah.
Yeah, we aren't like,
Do you wanna be a boy
we
today?
aren't like changing genders on folks for scenarios and stuff. No, we're good.
I thought she was being
Do
a
what?
patient.
What's her name?
so I thought-
Okay, y'all give it up for Jody when she comes in, 'cause she's being brave.
She is great, she is. So what was meds ended, did we put that on?
Hey Jody. Yay.
So, your scenario, such that it is 51-year-old white male presenting with headache and elevated blood pressure. Okay? Blood pressure is 156/94, pulse 69, temperature 81, stats 98%, time 81. All right. Past medical history, hypertension, hypothyroid, PTSD. Past surgical history, too numerous to list. No known drug allergies. You have ramipril, 10 milligrams, levothyroxine, 88 mics, duloxetine, 60 milligrams, and multiple supplements. That's what you get for your starting info, yeah? All right, questions about any of that before we begin? Will someone grab
I think this-
the yellow?
No, I'm gonna figure it out as I go.
The yellow bin with the supplies in it that's on that overbed table and the container of the tongue compressors, please. Alright, so you'll have some, supplies there if we need to utilize any of that, okay? Questions about anything before we get started?
Like mock clinical questions or actual questions?
No, like questions about, you have an understanding of all that.
I do.
Yeah, you see that, you've seen the instruments, you
I'm
have.
not exactly sure what systems, I know cardiac or blood pressure.
This would be up to.
See, you said mock, okay.
This would be for what you're doing, okay? So just remember to make sure that you fill in blanks of anything that's not provided. Make sure you cover an ROS, and then once you have all that, you'll have an idea of what other systems might need to be assessed.
Okay.
Good that you're already thinking elevated blood pressure. You're thinking need to do some cardiac already, right? But what comes before the elevated blood pressure up there?
The headache.
There we go.
Yeah, that's the one I'm kinda like, ugh.
What would you do? What should you do? You already know, you already have two systems right out of the gate with headache and elevated blood pressure.
That one I'm not sure.
Cardiac and what else?
Neuro. Neuro.
Okay, right, okay. So, you know you got two out of the gate, right? Okay, alright. So, good on all that? Yep?
Mhm.
Okay. Sheet, I want this like we're doing it for real next week. I want that sitting.
Yes,
Sitting over there, not,
Oh.
not looking at it the whole time. I want you to look at it when you need it, but I don't want nonstop.
Okay.
Okay? This ain't for a grade, this is just
Pretend.
getting a rep. Okay? That's all this is, so don't worry about that.
This is exposure therapy.
Don't worry about it. Alright, so time begins now.
I'm Jody, I'm your NP student. What's your name?
I'm Brent.
It's nice to meet you. What brings you in today?
You know, I've been having a pretty nasty headache for the last couple of days, and I've been checking my blood pressure at home because I take blood pressure medication, and it's been up compared to where it's usually at.
I see that it's running high today.
Yeah.
And when did your headache start?
About 2 days ago.
And where does it hurt?
Just kind of all over, you know, mainly probably a little bit more here.
And how long has it lasted?
It's been pretty continuous the last couple of days.
Have you had headaches like this before?
It's been a long time, probably since before I started taking my blood pressure medicine.
How would you describe your headache?
Painful.
Like ache.
Well, that's in the name, right? Headache.
Have you done anything to alleviate your headache?
Yeah, have taken some, the knockoff brand of Aleve and Naproxen.
How much have you, naproxen?
I took a couple yesterday and took a couple today.
Did it help?
No.
How would you rate your pain on a scale from 1 to 10, 10 being the worst?
6, maybe 7.
Is there anything that makes your pain worse?
Not that I can tell.
Any nausea or vomiting?
No.
Sensitivity to light?
No.
Okay. And, how do you manage your blood pressure?
Take my blood pressure medication, the Ramipril. Yeah, I've been on that dose for like ever.
How often do you take that?
Just once a day.
Any other medical problems?
Yeah, I'm gonna have, take medicine for my thyroid. I've got, some PTSD, take some medicine for that. It also helps with all my joint aches and pains though too, from all the surgeries that I've had.
Okay. On your levothyroxine, how often do you take it?
Once a day.
Do you take it with your other medications, or do you space it out?
No, I take that when I get up first thing in the morning, and then shower and just kind of get ready and stuff for the day, and then I take my other medications after I eat.
And then the duloxetine, how often do you take that?
I take that each night.
And do you feel like it helps with your trauma symptoms?
I don't really know if it's I guess. I mean, when I don't take it, I hurt more. I notice it more that way.
How's your anxiety been?
Okay.
Any nightmares?
And my wife says sometimes at night I'll be shouting out or doing stuff from time to time. Not as often as it used to be.
Any flashbacks?
What do you mean by that?
Like re-experiencing your trauma?
Only when my son's at the house.
What type of trauma did you experience?
I had to shoot my son and then revive and resuscitate him.
I'm sorry that you went through that. How are you coping with that?
But I'm taking my medicine and, doing okay. He's fine now, so everything's all good.
Did you go to any type of therapy or anything like that?
No.
Is that something that you feel like you need to do?
No.
And then you mentioned joint pain. Where is your joint pain?
Oh, it varies from day to day. But lately, I guess my back's been giving me more trouble than anything else.
How would you describe your back pain?
I don't know, daily for the last couple of weeks, I guess.
Like deep aching, burning?
No, not my back. I get burning other places, but not my back.
Does it come and go?
Yeah.
Or is it constant?
Yeah, kind of, yeah, everything.
And how would you rate your back pain from a scale from 1 to 10, 10 being the worst?
And some days it's, an 8 or 9, other days it's just kind of there, like a 2.
What helps it be a 2?
Exercise.
And what makes it worse, like on the days that are it's 8 or 9?
Stupid exercise.
Okay, can you elaborate?
So it feels good doing just like yoga, Pilates stuff, but then when I go do heavy weightlifting or stuff like that, but that really doesn't bother me that much anymore. It's mainly kind of bothers me after I play golf.
And when did your back pain start?
When did it start?
Mhm.
Gosh, over 20-something years ago.
Did you injure it or
Oh,
anything
yeah.
like that? How'd you injure it?
Which time?
Okay, well, tell me.
Let's see here. So I've had 5 surgeries on my spine. I've had this shoulder repaired, this knee repaired, this thumb repaired, a groin surgery, and then just a few months ago, after Thanksgiving, I had a hip replacement done.
After all those surgeries, how are you functioning with after all of that?
Slowly.
Okay, help me to understand what you mean by slowly.
Oh, I just don't, move as fast or do stuff as quickly as I used to, but still doesn't limit me, still work out, still do all the stuff that I like to do.
Any medical problems that we haven't talked about?
Right now, or like in the past?
In the past as well.
In the past, no. I mean, the only other thing that's kind of been going on is I've been having kind of like this dry, hacky cough that's been bugging me for about 3 weeks now, and just a bunch of nasal congestion and whatnot. It's worse after I've been having to like mow and stuff.
Do you experience seasonal allergies?
Not as bad as I used to, but yeah, every now and again I have to think about it. I'll take like a Claritin or an Allegra or something.
And then you mentioned coughing. What does it look like? What you've been coughing up?
Oh, nothing comes up.
Okay.
Yeah.
And what helps you cough?
Not coughing.
Like if you were to take something over the counter, would it help?
I haven't taken anything for it.
Any other surgeries that we didn't talk about already?
Trying to think what else. I had one for kidney stones. So, yeah, there's that.
And we talked about your medications. Do you take any over-the-counter supplements?
Yeah. Let's see here. So I take vitamin C, zinc, D3, B12, vitamin E, and omega-3 fish oil and DHEA.
And then do you take any other medications that you might not think of as medications, like eye drops, creams, inhaler?
I'll use some of this, it's a gel, it used to be prescription, went over the counter a few years ago, that I'll rub into my joints when they hurt sometimes, like my shoulder or my hip or something like that.
Okay. And that's helpful?
Yeah.
And then any allergies?
Well, I mean, whatever the stuff is, that's when after I cut my yard, so,
Okay. Any drug allergies?
Oh, no,
Any food allergies?
no,
Any environmental allergies, like latex cats?
there's cats made out of latex?
Just for example.
No.
And tell me about your family's medical history.
Dad has heart disease and high blood pressure. Mom has thyroid issues. Brother has diabetes.
What about your grandparents? Are they living?
No, they're all dead.
What did they pass away from?
Let's see here: liver cancer, pancreatic cancer, Parkinson's, and just old age.
And who do you live with?
My wife.
And how long have you been married?
15 years.
Congratulations. How many children do you have?
4.
And who would you describe as your social support?
My wife, my kids, my grandkids.
And are you working?
Yes.
What do you do?
I'm a babysitter.
And what's your highest level of education?
I have my doctorate in babysitting.
how is work going?
That's great.
Okay, any stressors?
No, tasers are great. Get kids to do whatever you want.
I've heard shock collars work well too. What are your spiritual beliefs?
I'm Christian.
You mentioned exercising. How often do you exercise?
4 days a week.
And for how long?
Hour and a half each time.
It's really good. And how's your sleep?
Yeah, hit or miss.
Okay. How many hours per night of sleep do you get?
Probably 6.5.
Any difficulty going to sleep, staying asleep?
Sometimes.
What do you do to help?
Not much I can do because my wife likes having our stinking dogs in the bed with us at night. So they're French bulldogs and they snore like freight trains. And so depending how hard they're snoring depends whether I can fall back to sleep easy or not.
And do you ever take anything to help yourself sleep? What does your diet look like?
How do you mean?
What would a typical day look like for you as far as like food intake?
Well, I try to eat every couple of hours. So small, high protein, lean fat type kind of meals or snacks.
And do you smoke or
No.
vape?
No.
Do you drink alcohol?
No.
Do any street drugs?
No.
Including CBD or marijuana?
No.
Do you feel safe?
Mm-hmm.
Okay, so I was just gonna ask you some general questions.
Sure.
Any fever, chills, night sweats,
No.
changes in weight?
No.
Skin rashes, dry skin, sores,
Don't think so.
changes in hair distribution.
Hair. You got hair jumps, huh?
I was gonna skip it,
We're asking the ball guy down here. Probably not the best person to ask.
Changes in attention or memory.
No.
Dizziness, lightheadedness.
Mm-mm.
History of seizures.
No.
Changes in coordination or balance. As far as ears, any pain, discharge.
No. My ears don't hurt.
Changes in hearing.
No. Sometimes I get like ear pressure when I get really congested, but that's all.
And as far as eyes, any redness, itchiness, pain.
No.
Do you wear glasses or contacts?
Reading glasses sometimes.
You mentioned having some stuffiness and drainage. Any sore throat? Any pain like in your mouth, lesions, sores, problems with dental concerns?
No.
When was the last dental visit?
I actually have one coming up on the 31st. So the last one was 6 months before that.
Any problem with like swollen lymph nodes?
How would I know?
Well, just history of.
No. Not that I've been told.
Palpitations, shortness of breath, chest pain.
No.
Pain with breathing, difficulty breathing, wheezing.
No. Now, sometimes my heart, you had said palpitations, I don't know about what that is. My heart sometimes beats fast after I'll drink an energy drink or two.
Okay. And how often do you drink energy drinks?
Every day.
And so you might want to limit caffeine.
Last couple of days, I've had like 4 or 5.
Oh yes, that can definitely cause palpitations or feeling that rapid heartbeat. Any murmurs?
I have no idea what
Any heartburn or changes in your appetite, food intolerance. I already asked you about nausea. Any vomiting?
Nope.
Any changes in bowel habits?
No.
Any difficulty urinating?
Nope.
Brain frequency?
No.
Concerns over sexually transmitted diseases?
No.
And we already talked about joint pain. Okay, so go ahead and start my assessment.
Okay.
I'm gonna have to update my notes. I'm gonna go ahead and examine your ears.
Okay. Do what you gotta do.
Take a look in your ear. Any pain there?
No.
Any pain there?
No. Is there an earthquake right now? Cause you shaking.
I may be having problems with anxiety. Any pain here? I'm not really able to see anything due to Zimmerman impaction. Let's go ahead and examine your nose.
Okay.
And nasal mucosa is pink and moist, and I don't see any polyps or obstruction. And then if I can get you to open your mouth so I can examine your mouth.
Rub cover off. Rub cover off.
See, you know a lot for a babysitter. Can I get you to open a little bit wider? Can I get you to stick out your tongue and say, ah? Okay, you can stop. Oral mucosa is pink and moist. Uvula raised midline, tonsils are 2+ and present. Pharynx is without exudate. And if I can get you to stick out your tongue and move it side to side and up and down. Okay. And that tests the hypoglossal cranial nerve, which is 11. Were you able to hear that? Hear that? And that test is the vestibulocochlear, which is cranial nerve 8. And that's going to palpate your sinuses. Any tenderness?
No.
I know you're hinting, but. And then I was going to take a look at your neck, and I see the trachea is midline. take a deep breath and hold it. Okay, and you can release. And take a deep breath and hold it. You can release. And no breathe bilaterally. And have a listen to your heart. In the aortic area. Pulmonic. Herbs point. Tricuspid. And mitral. And S1 and S2 are audible with no murmurs or friction thereof. Posterior tibia, those were popping too. And I can't feel anything with your shoes on. After your shoes. And no edema. Pulses are 2+ bilaterally. And can I look at your nails? No cyanosis or clubbing. Cavern vertical is less than 3. Skin tremor is less than 2. And I didn't observe any ejacular distenders. And if you can take a deep breath, breathing through your mouth. And just keep doing that. If you'll keep breathing that way, I was just gonna listen in the back. And when sounds are clear on auscultation, no accessory use, chest is symmetric, respirations are even in non-labors. And then you talked about your back hurting. And where does it hurt on your back?
Just like right over here.
Is it okay if I raise your shirt?
Sure.
I don't see any swelling. I was just gonna poke around. Can you tell me if you feel any tenderness?
No, feels fine.
And if I could get you to lay back. I was gonna get you to do a straight leg raise, so I'll have you just extend this leg. And then we're gonna raise it all the way up and let me me know when it hurts, or if it hurts.
Like, what's supposed to be hurting?
Just if you feel any pain.
My leg doesn't hurt. It gets kind of numb when you do that, but it burns a little, but it doesn't like hurt.
Okay. Where do you feel the burning and numbness?
In my leg,
Okay, where in your leg?
all the way down.
Okay. Oh, and you can go ahead and extend that. I'll get you to extend this leg. And then I'm gonna raise this leg too. Any pain, burning, numbness?
No.
And then you can go ahead and sit up. Okay, and if I can get you to stand. And bend over and touch your toes. Any pain with that? So
No.
you can stand back up. Any pain with that?
No.
Then I'll just get you to kind of bend backwards. Any pain with that?
No.
And then side to side. Any pain?
No.
Like kind of like that. Any pain with that?
No.
Okay, and then I'll get you to walk over to that computer and then come back over here. Okay, and gait is steady and coordinated. And so the straight leg raise was positive